Good day everyone, I am Nisha from Impact Exhibition Management. We are organizing a trade show called Medlab Asia and Asia Health together with Informa Markets. Medlab Asia and Asia Health is a trade exhibition for medical lab and medical equipment which includes business matching service and also scientific conference. For this year, we are running this show on virtual platform on 20th to 22nd of October. For more information on business matching or scientific conference topics, please visit medlabasia.com. Today's webinar, we will introduce you a new technology which called STH-PAS that brings the PCR-based test result with easy strip detection. Key features of these products are PCR-based high sensitivity and multiplex several different results shown on just one single strip. The clinical research results of dengue patients were equivalent to real-time PCR. The test can be designed for any target gene for any virus and bacteria includes TB, COVID-19, HIV, HCV, and drug resistance. What's the detail and how it works? Let's continue with our professional from TBA company. May I introduce you our speakers today, Dr. Yutaka Takarada. And next, Mr. Hitoshi Sakurada. Okay, so first, let's explore this new technology with Dr. Yutaka Takarada.
Hello everyone. I'm a R&D manager of TBA company. Today, I will introduce our basic technology, some clinical test results, and some application using our technology. First, I show our basic technology. Our technology is Chromato strip assay. Famous chromato strip assay is immunochromatography. The figure shows immunochromatography. The immunochromatography strip has labeled antibody and primary, secondary antibody immobilized in a line. Once add a sample on the end of the strip, the analyte move to the other end. While moving, the analyte bind to labeled antibody and make antibody analyte complex. After that, the complex coated by primary antibody. The residue move away. The result make a visual line. The DNA chromatography is similar immunochromatography. DNA chromatography has immobilized capture probe in a line. So, PCR product with streptavidin coated blue beads are on one end of the DNA chromatography strip. The product moves to the other end. When the product reaches the immobilized capture probe, the product hybridizes to the capture probe. After that, it makes visual line. The first strong point of DNA chromatography is easy to add the lines. This strip add 2 more lines. it is good suitable for multi-test on the strip. Second strong point is a single strand tag hybridization, STH technology. Standard chromatography detection, the PCR, usually PCR product is double strand. To detect the PCR product, it needs denaturation step. After denaturation, the product hybridized to capture probe, but at that time it competes to complementary PCR product. STH technology uses single strand tag primer. After PCR, the single strand tag is single strand, not double strand. So it is not need denaturation step. So no denaturation and easy hybridized to capture probe. It is second strong point. And our technology can detect multiple. So multi-primer design is important. This is example. Panel A, it can detect target A, B, C, D is 4 target. 4 target has different tag for different target. PCR specific primer, one of PCR specific primer has this specific tag sequence. Another specific primer has biochip. So after detection, the whole target detect separately. And other panel, example panel B target is W, X, Y, Z. The target specific primer is different panel A, but the tag sequence is same tag used. The result shows separately detection. This is third strong point. Common strip can be used for any panel. This example shows panel A, panel B. It can detect for individual for target, but the tag sequence is same. I showed multi-detection flow using our technology. Sample put into the PCR reagent, it containing multi-detection primer. After PCR, if sample containing the target gene, the specific primer amplicon produced. After that, an averaging coated blue beads put into the PCR reagent. The blue beads bind to biotin. So the result, the PCR product has tag and blue beads. Put into the strip, put into the mixture. After 5 to 10 minutes, if the sample containing the target gene visual signal line can occur. Another primers cannot not have blue bead, so only target line can visualize. Next, I will show the video of actual detection situation. Please see following video. This is PCR product blue bead mixture. Chromato strip put into the tube. Blue line clearly appears. Next, I will show clinical research result in Vietnam using our test kit. We choose 3 viruses, shows dengue virus, Zika virus, chikungunya virus. These viruses transmitted by mosquito, and these virus infected symptom is fever. Similar fever disease occurred from different virus. So our kit detect these 3 virus individually. Our kit named mosquito-borne virus 3. This kit can detect dengue, chikungunya, Zika at once. The example result shows number 1 detect dengue. It shows bottom line. Number 2 is chikungunya virus. It's second line. Number 3 Zika virus, top line. It can easy to detect these 3 viruses. Flow chart of clinical test at Pasteur Institute Nha in Vietnam. The sample collected in small and medium hospitals. The sample test immunochromatography NS1 test, and after that the samples transferred to Pasteur Institute. Pasteur Institute test qPCR and our MBV3 test. The comparison result is this slide shows. MBV3 and qPCR comparison result. The result shows the accuracy was 95%, and NS1 rapid test comparison result to MBV3 was 54.3%, and NS1 versus qPCR result 54.3%. the MBV3 and qPCR result was similar. Flowchart and test result of Camphor Hospital of Tropical Disease. This study was comparison to NS1 test. The samples were tested in Camphor Hospital. In Camphor Hospital occurred the NS1 test and MBV3 test. The result shows the accuracy was 92%. The comparison data is a good correlation. This clinical study conclusion is the MBV3 and qPCR result were highly correlation. But the between NS1 result and genetic test, MBV3 and qPCR, the test result varied depend on the measurement facilities. Second clinical test result, we tested subtype identification of dengue virus. Dengue virus have 4 subtypes. So our test kit can identify the types at once. The example result shows this slide. Type 1, type 2, type 3, type 4 is individual lines shows. Previously, MBV3 test and qPCR test in Pasteur Institute, the dengue positive sample were used. The result shows this slide. qPCR, it used multiplex real-time for dengue serotype detection in CDC and subtype test. The result for qPCR and subtype test were highly correlated. Next, I shows some application using our technology. First one is drug resistance. Carbapenem drug resistance occurred by carbapenemase. Carbapenemase gene is in plasmid. The carbapenemase for genes detection. This manuscript shows differential detection of these 4 genes in stool specimens. The photo shows the 4 genes NDM, KPC, IMP, and OXA48 genes separately detection. Second one is point mutation detection. Drug resistance occurred by point mutation. A point mutation detection by allele-specific oligonucleotide primer. Allele-specific oligonucleotide primer is using wild type and mutant type primers. The different tag attached these primers after PCR mutant type and wild type PCR product occurs. The product can detect separately by the tag, so the lines different position. This example is 2-point mutation detection for drug metabolism. Warfarin-related drug metabolism point mutation or geopolin-related drug metabolism point mutation detection shows many lines detection. Similar detection G6PD and mitochondria DNA. Another form of point mutation using allele-specific oligonucleotide probe. The allele-nucleotide probe hybridized to PCR product. The wild type probe and mutant type probe hybridized separately the mutation. So the tag also different sequence. After strip detection, the tag different position line occurs. This is example for Isoniazido drug resistance. Isoniazido drug resistance occurs by cut gene point mutation. S315T mutation detection shows wild type and mutant type clearly separated. Next example is rifampicin drug resistance. Rifampicin drug resistance occurs many point mutation in LupoB gene. This shows 11 mutation detection at once. Left end shows wild type detection. Wild type 4 lines detects clearly, and another mutation shows another line, so it can easy to detect the point mutation. Other application for isothermal amplification detection. Our technology is easy to detect the multiple detection, but usually isothermal amplification is difficult to multiple detection. This manuscript shows loop-mediated isothermal amplification multiple detection. There is 6 multiple detection using ramp amplification. Other famous iso amplification is recombinase polymerase amplification. This amplification also use our technology. This example shows MTB detection using RPA. It shows easy to detect using DNA Chromato strip. Today, I introduced our basic technology, some clinical test results, and some application using our technology. Thank you.
Thank you, Dr. Yutaka Takarada, for this new knowledge on detection technology. And next, let's see how this technology is contribute to healthcare industry. May I invite Mr. Hitoshi Sakurada to deliver a talk on how this STH-PAS is contribute.
Hello, thank you for joining our webinar. I am Hitoshi Sakurada, Sales Manager of TBA company. In this second session, I will explain our business model and collaboration opportunity in Asean countries, especially Thailand, Vietnam, Indonesia, Philippines. First, I will introduce our company profile. TBA is a university startup company of Tohoku University. Tohoku means Northeast National University. Our president is Professor Kawase. He established TBA in 2013, 7 years ago. And total staff about 10. It's a small-sized company, but we have patented technology and doing business in cooperation and collaboration with other universities and companies in Japan and in Asean. This is our product. As Dr. Takarada already introduced you in the first session, strip for STH-PAS technology. And this is our facility. We invented our own DNA printing machine. It's a kind of inkjet printer. But our inkjet printing technology is a very small volume and precise printing possible. So this makes possible our small molecule DNA reaction on the strip. And our office and factory are located in business incubator in Tohoku University. Recently, Japanese government encouraged this kind of university startup with advanced technology. So we are running our company receiving the investment. Our product is the key components for our STH-PAS test. As Dr. Takarada explained in first session, key components are 4 components: tag primer, biotin primer, latex and buffer, and PAS strip. We supply these 4 key components to our client. The point is, tag and strip are always same, even if the different target gene detection. The client designs a suitable primer for the different target, or sometimes we together co-develop the primer sequence. Suitable primer for the target sequence. So the target sequence is known and decided. Any target gene can be detected by our strip. Our PAS strip is good for infectious disease testing because most cases target gene is already known and can be detected by PAS strip. This slide shows examples our collaborator already developed a test kit using our PAS strip. Develop means primer sequence design and PCR condition optimization. So from top to the bottom, the examples, sputum specimen. From sputum specimen, the TB mark detection kit. TB means tuberculosis, mark means non-tuberculosis mycobacterium. And middle, from blood specimen, Dengue subtype advanced kit. This kit detects Dengue subtypes D1, D2, D3, D4 at the same time by one strip multiplex. And another one is the mosquito-borne virus 3 kit. This kit detects Dengue, Zika, Chikungunya at the same time by one strip multiplex. And the bottom example, from stool specimen, CPE detection kit. CPE means a carbapenemase gene. This is kind of drug resistance. So our client, our collaborator develop any new target gene detection according to their need and demand. For example, recently the COVID-19 test detection kit is under development. So this, we have many possibilities, but this slide shows a major detection kit already developed. We collaborate with other universities and manufacturers. We are a small-sized university startup company, so we have many collaborators since the beginning to do business and expand business. So look this figure. TBA, Tohoku University, focus on the detection technology, STH-PAS. So since the beginning, we collaborate with Gifu University for TB detection and Nagasaki University for dengue detection because they are specialized in bacteriology and biology, virus. So they developed, and we together developed a complete test kit package. And recently, we collaborate with Hokkaido University and Osaka University. They are developing the drug resistance detection. So we have a collaboration network in Japan, and now we want to expand more and more collaboration network in Asean countries also. Collaboration in Asean so far, I will explain a little bit. There are two kinds of collaboration. One collaboration is with research institute. With research institute, this is simple collaboration. We sell our product to research institute, and they are using our product for their research. Please look. The Thailand Chulalongkorn University is our collaborator. They are using our product for their research relating to drug resistance. This is still ongoing. And in the Philippines, this was a finished project. Centriux Medical Center, they used our product for their research about dengue detection with Philippines patients. And another one is in Indonesia, Airlangga University. This is just beginning. They are considering to use our product for their research about dengue detection with Indonesian patients. And another type of collaboration is with IVD kit manufacturer. This is more big scale business and very big potential and very promising for the future. In Vietnam, we have already partner company, Medlab JSC. They are pharmaceutical and IVD kit manufacturer. We are collaborating about dengue detection, subtype and mosquito virus detection, and also TB. We did clinical trial and on the way of government registration. Collaboration in Vietnam with IVD kit manufacturer. I will explain the business model for the dengue detection kit, clinical trial and government registration ongoing. The partner name is Medlab. They are IVD kit manufacturer. So from TBA, from Japan, we export, supply the PAS and the latex and the primer as a key component for the kit. And in Vietnam, Medlab is manufacturing the IVD kit. And we together did clinical trial, and Medlab now on the way of the government registration. So now we like to do similar business with other countries, especially Thailand, Indonesia, Philippines. We look for the new business partner of IVD kit manufacturer. So conclusion, in this session, I explained our business model and collaboration opportunity in ASEAN countries. We already have some collaboration, but we like to find more collaboration in ASEAN countries with research institute in all ASEAN countries and with IVD kit manufacturer with ASEAN countries except Vietnam. Thank you for listening our own presentation, first session and second session. For more information, please check this QR code. This is our website. You can contact us, contact from our website or email or phone. We welcome your question and inquiry always. Thank you very much.
Thank you, Mr. Hitoshi Sakurada. It was a pleasure for us to host a webinar today. We hope it provides a useful scientific knowledge to our attendees today. Thank you, TBA company, speakers, and our attendees. If you are interested in this new technology, please visit www.t-bioarray.com, www.t-bioarray.com. After this session, you will get a presentation file by email. Just easily reply our webinar survey. Thank you, everyone. If you have any inquiries on Medlab Asia and Asia Health or a webinar service just like this, please email me at nichaa@impact.co.th, nichaa@impact.co.th. See you again on the next episode. For today, สวัสดีค่ะ